So, I'm going to talk about local public health. I'm going to give you a little bit of an overview about what public health is, and then break it down in terms of what we do as your local public health or town nurses. So this basically is what your Massachusetts Department of Public Health says is kind of their mission statement. You know, protects and preserves, promotes improved health. That's basically what the mission is. I'm not sure why, it looks a little funny there. The Centers for Disease Control is your kind of national public health benchmark, right? So it starts at the nationwide level. And then from there, there's each state has their own Department of Public Health. And then from there, that gets broken down into the local public health. So these 10 essential functions of public health are basically kind of coming down from the Centers for Disease Control. And this is what we take as our guidance for our core functions of what we need to do. So you can see monitoring health, we're looking and assessing the community, seeing what's going on, looking for trends and how to intervene or come up with ways to address any issues that we see. Diagnosing and investigating, we do disease surveillance and investigation and reporting, which we'll talk a little bit more about. We inform and educate, right? We have these talks. Sometimes they're a community-based program, sometimes it's one-on-one, sometimes it's a simple conversation with someone in their home about something very specific. Mobilize community partnerships, we work with all kinds of different groups. We work with other resources that are in the community so that we look how to collaborate together so that we're not missing any issues and try to figure out who can do what and how we can partner to cover all the bases. Policies at the bigger levels, trying to, based on what we assess and see as needs in the community, and then we try to broaden that and see how we can make the most impact. So it's individual but community, and then we try to broaden that. To address everybody's health and wellness. Enforce laws and regulations, and that is a piece of what we do, and I'll explain how the nurse role actually fits into that. And a big part is where you see that little heart, linked to and providing care. A big part of what we do, not only being at the clinics, but interfacing with people in the community, is trying to identify what the needs are and helping people make those connections and accessing the care and services that they need to be healthy. We have a duty to make sure that our workers are competent and have the appropriate licensure. And then we try to evaluate what we've assessed, what we've implemented, and does that actually work? And if not, then we need to reevaluate and maybe try something different. And that's also where research comes in as well. This is not an eye test. It's not meant for you to read it off. But what is the role of public health? Basically, why I put this slide on here, and that logo is the Massachusetts Association of Boards of Health, is what that MAHB is. It's basically explaining to you that there are laws in Massachusetts under their general laws that guide us and provide regulation in terms of how we are going to protect and preserve and promote the public's health. And there are laws that give us the guidance to do that. So that's basically what that was saying. And that at the local department, we are fulfilling all of those duties that I just showed you, those 10 core functions. So here are some fun facts and trivia. You know me, I like to try to include something. Massachusetts, yay us, we were the first to record vital statistics, and we were actually the first to have a local board of health, a local public health. So that's pretty interesting, I think, in terms of across the country. We're the first. And our first Board of Health was established in Boston. It was 1799, and the first president and or chairperson was Paul Revere. So I just thought kind of, right? He was a man who was very involved in a lot. And I think it's interesting, he and his fellow board members at that time, when that law became into play, were given authority to control, quote unquote, the filth and offal that contaminated the environment and produced deadly epidemics. So back as far as 1799, Paul Revere was our guy, Massachusetts was the first. So kind of interesting. And then I just put information in case you guys are interested. There is a public health museum at the Tewksbury Hospital. Kind of interesting. I think it's free. If not, it's a minimal cost. But they have some interesting exhibits you might want to see about public health. They have an iron lung display in there. They have some old dental equipment. And it's kind of an interesting thing if you're looking for something to do on a day. But I thought you might like to know that. And then how local health departments, these are kind of some things that we may be involved with. Immunizations, you guys might have taken advantage of our flu shot clinic that we had here in town. Food safety, there's food inspections and licensing and permitting that needs to happen. And then on the public health nurse side, we do some investigating of foodborne illnesses. We'll talk a little bit more about that. Infectious diseases, we investigate, we try to prevent spread of infection, find reasons for people becoming infected and try to minimize that. Chronic diseases, we educate and try to promote that, how to manage that at home. Injury, violence prevention, environmental health, emergency preparedness, all of those things kind of fall under the public and local public health umbrella. This slide is just to show you, remember we talked about partnership and collaboration? All of these different people are working together in a concerted effort to try to meet those public health guidelines. And we collaborate with all of these people. It could be your EMS, fire, police, councils on aging, outreach workers, doctors, clergy, friends, neighbors, hospitals. It can be community development and planners, right, for things of safety, and maybe they're trying to increase walkability in a town. So that goes into the planning and zoning departments, and maybe looking at sidewalks and lighting and things like that. So they all kind of collaborate in an effort. Local health department is the orange circle in the middle. Schools, I am not your school nurse, but I do collaborate with your school nurse team in all of the towns. Civic groups, so mental health, all of those, we're all related and we all have our part to play in the public health promotion. This is, again, not an eye test. This is really just for me to remind you. So I wanted to talk a little bit, and in your packets, and I'll make sure I get a copy to you, I put in there a little history of Neshoba Associated Boards of Health to give you a little explanation of where we came from, and I'll talk about that. But basically, Stow is a member of the Neshoba Associated Boards of Health. Neshoba Associated Boards of Health is a local regional health department. Basically, each town that's a member, they pay assessed fees to us to do their public health work. We're the feet on the street or the boots on the ground people, making sure that those mass regulations we talked about are followed through with. Having said that, each town has elected their Board of Health members. So Stow has Board of Health members, as do our other member towns. And we, our health agents, actually go to those meetings and interface with your elected members. So we are under the guidance of your local elected members. But we are the ones, the nurses, the hygienists, the registered sanitarians, that are actually doing the daily work for you. So it's Neshoba Associated Boards of Health is the big umbrella as the agency. There's a public health side department, and there is a nursing service and hospice department. The public health side has three branches of it. One is the public health nursing, which is what Susan and I do, and I'll talk about that. One of them is the dental program, and the other piece is the environmental, which includes our registered sanitarians. The nursing service and hospice, is a little bit different than what we do. That's what most people think of as a traditional visiting nurse association or home health nursing. It's a little different in that that is for a short-term specific need to meet specific goals. And in the case of hospice, it's through end-of-life care. That's a little different because that's insurance, reimbursed by insurance, and that requires doctor's orders for that kind of care. So for instance, that may be somewhere if you were in the hospital and you had an issue and then you got discharged to home and the doctor wanted to make sure you had some monitoring, oversight, more teaching maybe looking at your medications, effectiveness, then you might be prescribed some home health services. So that's one part of what we could offer. But the other side is the environmental and public health and dental piece under your Board of Health umbrella. So this slide specifically explains that you have 6 registered sanitarians that function as your health agents For Stow, it's mostly William Brookings, and some of them, they all help each other as needed. Jim Gareffi also works here in Stow, and the others help too. But their role is basically looking at enforcing the state sanitary and environmental codes. They do camp inspections, beach inspections. They're involved with Title V and food inspections, addressing any complaints or concerns that come in. So again, it goes back to those Massachusetts regulations that they're monitoring and making sure are all set. So you have your sanitarians, and then you have your dental hygienists. Back in December, some of you may remember that Elise, the hygienist on the left, she actually came out and did a little talk, and she, do you remember that? Yeah, she came out and she talked about oral hygiene. But their main job, we have two for the district, and it's Elise Mueller and we have Suzanne Dunphy. We don't really see them very much because they're out in the communities and they're out in the schools specifically. And their role basically is they provide screenings, dental screenings at no cost to families. If a school is on board with the fluoride program, then they can help out with that. And they also provide in-classroom education to students about dental health and how to take care of their teeth for the kids. And that's kindergarten through grade 5. And so that's part of what you get by being a member of the Neshoba Associated Boards of Health. That's part of what your fees are paying for. All right. Did you know you have a town nurse and a public health team? I think most of you here do, right? And then, as I said, these services are provided to you by your local Board of Health in partnership with Neshoba Associated Boards of Health. So these are actual pictures from our archives, and there's some of them in your packets you'll see. The picture on the left is actually from about the 1950s, and that's the same building today. It's on Central Avenue in Ayer, Mass, and the building looks pretty much exactly the same. Small little brick building. All of our 6 sanitarians are in there. The nurses are actually in a building right behind them. So that's the building. And then these are actual nurses providing care and making home visits. Kind of interesting, you might want to see. I'll give you a little quick snapshot of Neshoba Board of Health. So basically, it was established in 1931. And in your packet, there's actually a 60-year timeline of milestones, which you'll find kind of interesting, on the involvement and development of local public health locally, which you might be interested in. But it was established in 1931, and it came basically in a response to 1918. What happened in 1918 health-wise? Yeah, the great flu pandemic, right? So what happened is the local towns really struggled during that time. It was a really tough time health-wise in history. And very interesting fun facts is a lot of those, some of that disease ended up getting spread right at Fort Devens, which was an army base out of Ayer. So kind of interesting there. But they found that they really struggled. So for the next decade and a half or so, they were trying to figure out how can we respond better, how can we really protect and promote the health in our communities. So what they decided was for these local towns to band together, kind of pool resource and assets, and deal with it as a region. And hence, Neshoba Associated Boards was established in 1931. And so they had sanitarians and doctors and nurses, and they evolved in having social workers, and then that branched out into a home health service and eventually hospice too. So it's been around for quite a while. These are the towns that are members, the dark green towns. So we have 16 towns, actually 17 if you include Devens, which is a kind of an interesting little community. But those are the towns that Susan and I cover for public health, and the sanitarians and hygienists as well. This is our mission statement, our nurses, that we want to serve all of our community, any age, so it's across the lifespan, not just seniors, but from babies right on up. And we really want to just promote good health in our individuals, families, and communities. This is a little collage of Susan and I out in the communities. You might recognize there's some familiar faces at the table there. The bottom left was a talk we did here on heart health back last February when we do some education like we are today. We participate in health fairs to try to to talk about the illnesses that are preventable. And one of the ones that we talk about or see a lot in our community are the tick-borne illnesses. So you can see a couple of fairs where we provided education and information about those. Yep, and the top two left, those are flu clinics that we were involved with. One of the things that we do to try to protect health is vaccination clinics in the fall. So as I showed you in the beginning, there was those 10 essential public health functions that kind of came from the nation CDC-wide to the state departments to the local level. Well, Susan and I are nurses, so we actually follow even a specific scope and standard of practice based on the American Nurses Association standards. So just so you know, we're not willy-nilly just doing what we want. We actually do follow those 10 core functions, and then you can see all the things that the scope of a public health nurse are on your right, all the different things that we're doing, outreach and screening and teaching and disease investigating, organizing and collaborating and case management and referring people. All of those things fall under our umbrella of what we do. So some of the services that we provide are the clinics, which some of you take advantage of, mostly in all of those towns that you saw on the map. We're in each town once a month, and it's basically like nurse drop-in hours. You can come in, have one-on-one time with the nurse, talk to the nurse about anything that may be concerning you, any questions you may have for consultation, and maybe referring you to the appropriate support or resource. It's also meant you could have your blood pressure checked, you could have your blood sugar screened, anything that you have a concern about, we're there for you, and those are designated hours in those towns. However, we are available Monday through Friday, 8 to 4. We just might not be exactly in your town, but you can call us. We're not meant for emergencies. In that case, you'd call 911. But certainly we're there for you if you have questions and you're trying to work through some things. So one way to see us out in the community is at a clinic. Another way is we do make home visits. And basically what we try to do with those home visits is we're trying to assess the situation, what's going on with you, how can we be helpful, what might be helpful to you to keep you healthy and safe at home. And then based on what we see, we might talk to you about what other resources might be helpful, and we can help coordinate that for you. That's a little bit different than your traditional home health or a VNA, Visiting Nurse Association nurses. It's free for us to come out and talk with you and see you at your home. But it's also limited with what we can do. We're not meant to go every day or several times a week for wound care. If that were the case, something like that, then we would probably request a doctor's order for some skilled nursing to go out and through a home health agency. And they get reimbursed by insurance, so it's a little bit different. But we do make home visits to assess you a situation and talk with you if that's needed. So you could always call for that. Another piece of what we do is very behind the scenes, and you might not know unless you were directly impacted by one of these illnesses. In Massachusetts, there's a whole long list of diseases that are communicable infectious diseases that by law, those public health laws we were talking about, are reportable to the State Department of Health. Reportable, and we investigate and we follow up. And that may mean education. A lot of times that's done by phone call. Sometimes that requires a home visit. Sometimes it requires daily home visits for almost a year in the case of a suspect active tuberculosis case. But there's a bunch of diseases that are listed that the state requires that we follow up on. So what happens is you might go to your doctor because you're sick. And the doctor might order a particular lab to see what's the cause of your illness. And then that lab shows the results that, oh, this is actually an infectious reportable illness. So what happens is the labs in Massachusetts are directly linked to the state lab, and then that state lab trickles it down based on where the person lives to that local health department. So for Susan and I, we check every day, we check our database multiple times a day, and we're looking for other illnesses that need to be followed up on. For instance, salmonella is a GI distress, usually causes nausea, vomiting, diarrhea. That would be an illness that we would follow up on. We would give you a call, we would verify with your doctor, did you see this lab, does the person know? And then we'd follow up with you, how are you doing? We try to, in the course of our discussion, try to figure out maybe if you had something to eat that was unusual, or did you travel, or did you have any animal contact, or were you out swimming somewhere or camping. We try to figure out what might have been the cause of that. And then mostly it's to check and see that you're okay, and if you have any questions. And then based on those questions, we fill out a report, and that gets sent directly to the State Department confidentially. And basically, it's meant to look for trends and also to find common denominators and outbreaks and things like that. The whole goal is to prevent people from getting sick. If we find something where there's a common site that everybody bought blue melons at, Healthy Mart over down there, then, and they all got sick, then we would know that we'd need to investigate that further. Sometimes those investigations we're working with the Centers for Disease Control because it's a nationwide thing, and sometimes that's a lot more questioning. So those are kinds of things that we're doing behind the scenes that you may not realize that we do. We work very closely with the State Department of Health and the epidemiologists there. So some illnesses are the salmonella or the GI type sicknesses, the foodborne illnesses as we call them, things like pertussis. Anyone know what the other name for pertussis is? Whooping cough, tuberculosis, and then as I showed you in that slide, those tick-borne illnesses, we see a lot of that. In fact, we're coming into that season. I know it doesn't feel like it today, but ticks are around year-round. They're out and about. Yeah. So we're starting to come into that season where that will be more of a problem of getting, if you get bit by an infected tick, and then you could get sick. And, so those types of things we see in our area. All right, we just basically went over that, so we don't need to talk about that. Any questions about that piece of what we do? No? And then beyond the clinics, beyond the home visits, beyond the disease investigating, we try to do some of these other things like the educational programs. If there's a community event, a health fair, or something that's a well-established community event that we could have a presence at, then we try to participate. Partnering with our communities, case conferencing if there's a sticky situation that we kind of need to have a meeting of the minds and how can we be helpful. And then for people that have some hoarding behaviors or clutter issues, sometimes we interface with our health agents and our sanitarians, because they're responding to a concern or a complaint, and we try to come from a place of care and concern, and how can we support you? Did you know that there are these resources available to help you and to help make your environment at home easier to manage so that you can do your daily activities in a healthy and safe way? So we can help out in those ways too. In fact, Stow has, we actually did some partnership with a group called Clear Path, and there is a clutter support group here that's been established and has gone very well, and we hope to keep that going. So it's just a resource for people that may need that kind of help. So some other special programs we can do. And then when you call us, and I think most of you know our business cards are out at the front table, but those are our numbers. They're in your packets. And for those who came in a little bit later, I'll make sure you have a copy of the packet. And then basically it's for someone who may be at risk, or someone who's underserved, or for anyone who has a question or a concern, someone who has an illness. Who calls us? Friends, families, neighbors, doctors, clergy, councils on aging, outreach workers. We get calls from everybody. We've gotten calls from oil companies concerned about somebody, maybe not having heat, or worried about what they saw. We've gotten even calls from the post office, the mail department. Someone's mail hasn't been picked up. How can we do this? We've worked with police and fire on wellness visits and wellness checks. So it can come from anywhere. We're really there for whoever may need it. And then, of course, you can see us out at our clinics. So I think, that's the end of the show. Anyone have any questions at the moment? It's a lot of information.
A long time ago, when I was, in first grade, my sister, who was 6 years older than me, got scarlet fever. And the Board of Health came down and they nailed a thing in the house, quarantined. And I couldn't go out of the house.
And so it's those types of things, the isolation and quarantine guidelines are still in effect. for different diseases,
But
and
not
that's
that anymore.
no, it's all part of those laws that we talked about, those regulations that, you know, there are certain illnesses that require either self-isolation, you know, someone stays home, or, you know, you've heard of kiddos not being able to go to school for X amount of time because they have whatever. Those are your Massachusetts general public health laws that make that, you know, be. And we kind of try to enforce that, and that's our role, you know. Some of our disease investigating, like, you know, there are cases where we may interface, a person maybe they don't live in one of our towns, but they work in one of our towns. And if we had somebody who had a GI illness who happened to be a chef, then we certainly wouldn't want them working as a chef, right? Because they're gonna cook your food or make your food and potentially make other people sick. So the laws in Massachusetts are that if you were a food handler, and that's defined in a certain way, it's not just handling food. It could be me as a nurse if I were helping administer oral medications to somebody, or if I were helping someone to eat food, you know, in any way had anything to do with their mouth. That would be considered a food handler. Then I would not be able, if I was sick with salmonella, I would not be able to work in that capacity by Mass General laws until I was free from that illness. And that's proven by lab work, you know.
Was polio contagious?
Yes,
It
Yeah,
was?
at the time, yes, because my son had.
yes,
It
it was. And it's so, you know, that goes to vaccine preventable diseases, right? I mean, nowadays, we don't really think of that much because we haven't seen it, right?
Right.
Since that
Yeah,
era.
absolutely.
And so, but that just goes to kind of highlight the importance of those vaccinations and immunizations, that a lot of those illnesses that were more commonplace then and really impacted people's lives in such a
Big time.
great capacity, you know, that we've almost eradicated those diseases, you know, so it speaks to the effectiveness of some immunizations, you know, and the importance of that. We don't always think of that.
I remember going to school and they put a little drop of something
Yes.
on the sugar,
That's right.
and that's how you get the polio vaccination.
And back in that time frame, your local Board of Health actually did the immunizations. You know, all the kids would line up in the well baby
yep.
visits, and they were done through the Board of Health. Things have shifted in healthcare now so that people have primary care providers, and essentially your primary care provider would take care of that, you know, and making sure that you had all your immunizations. But we at the Board of Health, right now, we're basically, our immunization that we focus on are the flu vaccines every year, and you get your other immunizations through your primary care provider.
How did the flu get out of control this year?
So it's a good question. Every year, and it's kind of a fascinating science that goes into the manufacturing and research of development of the
Right.
flu vaccine.
Right.
And why you have to get it every year is because the flu is a virus, right?
Right.
Viruses have learned, they're smart, and they can mutate and change. So each year, or every other year or so, there's a little thing called this antigenic drift. All it means scientifically is that the virus is evolving and changing and getting
Changing.
smarter.
Right.
And so that's why each year the vaccine is different, because what happens is the State Department of Health will actually have some pilot sites out there, some testing sites. Like now, all flu season, you've heard about people getting tested for flu. I
Right,
had A
right,
strain, I
right,
had B strain.
right.
Well, what's happening is we're testing what strains are out in the community. And the State Department and the epidemiologists and researchers will take that information and see what strains were circulating. And then they'll shift it and they will create the vaccine based on what they saw. And so you always get, it's a certain amount of effectiveness. It's never going to be 100%. They do their best guess based on their best scientific research methods, and they shoot for it and they try to get it.
Yeah.
I'm sure there'll be some changes based on this flu season for next year's vaccine.
Yeah, because normally you don't hear about people passing away with the flu. I mean, you know, you're very sick and this
Right.
and that, but normally,
Right.
you know, going back to, what was that,
1918 was the, yeah. the-
Was there a worse one in the late 1800s?
I don't know. Did you, what's that?
Killed a lot of soldiers
Yes, it did. Yes, it did.
in the war.
Because I remember watching a show, and this team of researchers went up to the tundra
Hmm.
because there was seamen up there that had gotten sick.
Hmm.
and died with the flu and were buried there. And because of the cold, they actually went up there, dug up the graves to get DNA so they
Interesting.
could see what that,
Oh, that's interesting.
what that virus was.
Yeah.
So they could, you know, if it came back again, they'd be able to fight
That's
it.
interesting.
Yeah.
If you're a reader and you like historical books, you might want to pick up the book The Great Influenza. I think the author is David Barry. It speaks about the 1918 pandemic specifically, and it's kind of interesting because there's local history there. You know, as I said, the Army base in Fort Devens and how some of that illness got disseminated with the soldiers and how sick they were. But I do not know. I know that the year 2009, that H1N1, which was an A strain of influenza, was very, very similar to the Spanish flu or the one that was the 1918 causing problems. And you guys remember that was just a few years ago, well, 9 years ago now, but where that was a big problem and there was a big demand for flu vaccine and kids were getting really sick. And but you know, I think you mentioned that you don't hear of deaths, but there are a significant amount of deaths related to influenza every year.
Really?
Yes.
Oh.
Yep. And I think so. It's still a serious illness, and I think what people may not realize too is that it's just not. When you get a flu shot, you're protecting yourself against influenza the best way that you can. It's not perfect,
Right.
but it's better than not. And typically, when you get your flu vaccine, you are probably going to reduce your chance of getting it. But even if you do end up getting the flu, probably the course of the illness would be shorter and the severity will be a little bit less. So you may not feel as sick. The other thing is that one of the potential complications of influenza is pneumonia. So, you know, when you're getting a flu vaccination, you could also kind of be preventing some pneumonia complications too.
Is that the thing that really kills, what actually kills you with the flu? I mean, you sweat, you're probably dehydrated, but, you know, you can be hydrated.
Yeah.
Is it pneumonia or what
You know,
what
I
actually
think it
brings it down?
It depends on the person's underlying health conditions as well, and how hardy they are, and how their immune system is able to fight things off, and the
Okay,
condition
yeah.
of their other organs. So I think that plays a factor into it, is how healthy someone else was. But everyone's a little different. So, I mean, certainly the stress on a body can impact someone's heart and their
Well, that's
function,
true, too.
you know, so there's no clear answer for that one.
And one other question.
Yeah.
Is the flu vaccine, is it all made by eggs? Is it part of eggs? Is
So
that-
that's a great question. So yes and no. There are vaccinations out there. There's a manufacturer specifically. There's a vaccine called Flu Block, and I cannot remember the manufacturer. I want to say Merck, but I could be wrong. That one is a. Hello.
I've been waiting for that.
Saved by the bell.
I've been waiting for that since 9 o'clock this morning.
Oh gosh. So the Flu Block is a recombinant vaccination. It's made a little differently, so it's
Recombinant.
not made with
Okay.
egg protein.
Right.
And that was specifically developed for people that had egg allergy.
Yeah, that's, yeah.
Yes.
Yeah.
And so they're actually talking more about a broader usage of that because they have found that that particular
In about
vaccine
5 minutes,
has a little bit
I'll
better
walk out.
coverage. So we'll see. Stay tuned for how that will evolve.
Okay.
Yeah,
You know?
okay, I'll do that.
Yeah, because I know I heard of people that have
Right.
allergies to eggs. And
That's right.
That was
But
that was
so
a problem for them.
So there is a vaccine that's specifically tailored for people that have allergies to eggs, but most vaccines are made with some of the egg protein. That's how it's
That-
manufactured.
that's valid.
Although they have been doing a lot of research to find out, is first of all, there's not a lot of people with true egg allergy, anaphylactic, and that means, you know, wheezing in hives and not able to breathe, reaction, you know, so that's kind of, that's not, it's pretty rare to see that. But most of you probably, if you're 65 or older, you might have gotten the high-dose flu vaccine. So that's an option to think about for next fall. You know, that's an option for you. It's what they call trivalent. It means it protects you against 3 strains, 2A and 1B, but it has a higher potency to boost your immunity better. Research has showed that for seniors 65 and older, it takes a little more boost to get a better immune response. So some of your providers might recommend the higher dose vaccine for you in the fall, typically October, so, be looking out for next year.
Well, a lot of things that we remember, maybe you didn't get them, and you don't hear about them anymore. German measles, the mumps, and chicken pox, are they gone?
So
Not
there's
really.
still vaccinations for measles, mumps, and rubella,
Yeah.
which is the German measles.
Right.
People are vaccinated. That's a childhood vaccination. There's a whole series
Oh,
that
really?
children get.
Okay.
And there's a chicken pox vaccine, which I didn't have when I was a kid. You didn't have
No,
when you were a
no,
kid.
no. And
But
mumps.
yeah, well, and there's a vaccine that's all three: measles, mumps, and rubella. It's
Now,
all
those
three.
required for going to school?
Mhm.
Yes.
Like the, what was that other one?
That
you
was
all said?
smallpox, which is eradicated. Yes,
Yeah,
that was the
okay.
one that leaves everyone
Yeah,
has the
the
little mark on
little
it.
tattoo.
Yeah,
Because
yeah,
I got one of those.
yeah,
Yeah.
yes.
We
yeah.
all do.
Yeah, that one was.
Couldn't get in school without it.
No, yeah, we all have those little scars from the
Oh, so that-
bifurcated needle that they'd have to jab in.
Jab.
Yeah. I was trained how to do that, but I never had to give one, thank God.
Oh,
But yeah, yeah.
so those other ones are.
So
all
measles,
under
mumps, and
control.
rubella is still part of childhood vaccination schedule. Chickenpox is still part of childhood vaccination schedule. Now, the thing with chickenpox, I'll be curious to see as decades go by what happens with shingles in future.
Mm.
Why? Because
Well, it's part, if you had chickenpox,
You
you're
get it
subject to
again.
get that.
so that's what happens
You
if
can.
you've had chickenpox.
Yeah.
As a
kid,
child,
yeah.
It lies dormant or sleeping in your body,
Mm.
and then for some unknown reason, we don't really know why,
Yes.
stress, whatever, it could later in life come out as shingles,
Shingles.
right?
Yes.
So I'll be curious to see in this generation of kiddos who have been immunized against chickenpox, what happens with shingles too. Maybe there'll be a,
Well, I
you
got a
know.
shingles vaccination.
They do, they have two. They have a new one that just came out for younger people 50 and older.
Because I remember when I was at the doctor, I had a shingles attack, but it was small. And I remember I went to him and he said, went away and don't worry about it. Once you have it, you never get it again. So then he asked me 10, 15 years later if I wanted a single shot. And I said,
Yeah.
no, I already had it, I won't get it. He says, oh, you can. Who told you that? And I said, you did.
Well, probably over those 10 years, we do find people can get shingles again. It's not all that common, but you can.
Yeah.
And that, again, I'll go back to the immunizations. None of them are 100% effective.
Mhm.
But you do, when you get immunized, you have a better chance of not getting the disease in the first place, not 100% chance.
Right.
And then you also could reduce the length of the illness and the severity of the illness,
Now
so.
they get pneumonia shots too, which they never had before.
Yep, and there's two different types of those.
Oh, really?
Yes.
I didn't know. I got one, I don't know which one.
Talk to your doctor, because you probably need the other one.
Mm.
Yep. And, so there's two different types of, it's not, they call it pneumonia shot, it's actually pneumococcal, and that's just the bacteria that causes it.
Mm.
Mostly we know it as preventing a pneumonia, but it also protects against pneumococcal diseases. Now, some of the other diseases that are caused by pneumococcal bacteria could be a meningitis, and there's a blood disease. So you're not just protecting against pneummonia.
Okay.
You are protecting yourself
Against
against some
other
other
things,
things. Yep.
too.
And again, not perfect.
Yeah.
But that first pneumococcal vaccine that you're talking about protected against 23 strains of pneumococcal disease. They picked the top 23 that were most commonly circulating. The second one that was more recently recommended for seniors is actually part of the childhood routine vaccination schedule. It's a conjugate vaccine, and that just has to do with how they create the vaccine.
Right, right.
But they felt like that seniors could get even broader protection if they got both of them. But they have to be given a year apart. So if you've never gotten any pneumococcal vaccine, they recommend you get that new one first. It's not new, but newly recommended for seniors.
Right.
You get that one first, and then a year later, you would get that other pneumococcal vaccine.
I just got one 3 weeks ago.
Did you?
Yeah.
Good, good.
Which one?
I don't know, the doctor recommended it, I accepted.
So besides vaccinations, what is the number one way to prevent illness? Number one.
Hygiene.
Wash your hands.
Oh,
Wash your hands. That is the number one. How long are you supposed to wash your hands for?
20
In seconds. Yeah, 20 seconds is good. I'll take it.
40, I think, is
15 to 30. So you good, right in the middle there. Well, how long is 20 seconds though? Are we counting? Sing happy birthday twice and you'll know
yeah,
you've
that's
done
what
it.
somebody
Yeah.
said.
Sing happy birthday
Who
twice.
wants to be singing happy birthday all the
You
time?
can sing the ABCs, that'll work too. That's what I teach the kids, yeah. Yeah, hand washing is still the best way to prevent. And don't touch your mouth, don't touch your face, especially in flu season. Keep your hands away from your face. Don't scratch your eye, don't touch your nose. And if you do, wash your hands. Still tell my kids that. They're 20 now, but they still
Yeah, but you still have to remind
still have to
them.
tell them, did you wash your
Yeah.
hands?
Yeah. Did you wash your hands?
Right.
Go back.
So thank you for coming and staying, and hopefully you learned something about what public health, what we do, and what we're here for, and